Calendar for the day. The first bill on the calendar for the day is Senate File 4410. The clerk will report the bill.
Senate File number 4410, number 1 on the calendar for the day, an act relating to Health and Human Services, the unofficial engrossment.
There are amendments at the desk, but if there's no objection, we'll let the authors explain the bill before we act on amendments. The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker. Thank you for letting us describe the bill a little bit before we begin to consider amendments to this bill. There is a lot to discuss in this bill, and I would just like to start by saying that this year alone, the Health, Finance, and Policy Committee, which is just my portion of the bill, heard 126 bills, including 96 from members of the legislature. And most of that work and all of those hearings were done remotely. So for every bill that was introduced and for every bill that got a hearing, there were hardworking folks making it happen, and it was a lot of work. So I need to start by thanking some of the amazing people, some of the smart, creative, dedicated, and hardworking people who made that all happen and got us to where we are today. So first of all, our House research staff, nonpartisan House research, and I know every member of the House really appreciates their work. Elizabeth Clarkvist, Randy Chun, Danielle Punelli, Sarah Sunderman, and Annie Mock, they are just our stars. The revisor staff, who work so hard, and most of us don't ever meet them, but they do so much for us. Alex Willie, Dean Trefts, and Sandy Glass-Serrani. Our House fiscal staff, Doug Berg and Joe Harney, again, amazing folks. Our partisan researchers who worked so hard for us on both sides of the aisle, Joe Durheim for the DFL and Jeremiah Wingstead for the Republicans. Thank you for your hard work. I also really do want to appreciate here, acknowledge the commissioners who work so closely with us, Commissioner Jan Malcolm of the Department of Health, and Commissioner Jody Harpstead, the Department of Human Services. And I want to thank Governor Walz for appointing them and for listening to them. They do amazing work for Minnesotans. You don't know how lucky you are until you've worked with these people. And they have amazing staffs working with them and for all of us, especially Lisa Timian, who works for the Department of Health, and Matt Burdick, who works for the Department of Human Services. And I don't know how these people do it. They are just amazing. And their fiscal teams, Elise Bailey and Shar Kimber, and all of the people behind the scenes who most of us don't meet, but just work their tails off every day to make this enterprise work and to serve Minnesotans. And finally, before for the thank yous, of course, I cannot forget my committee administrator for the Health Committee, Patrick McQuillan, who does the work of 2 or 3 people, I must say, and my hardworking and extremely knowledgeable legislative assistant and committee legislative assistant, Krista Niedernhofer. And finally, I want to acknowledge my co-chairs and colleagues, Jennifer Schultz, who's going to be speaking as well, and who is serving her last term here. And I just can't say enough about Jen and her work and smarts and dedication. And Mike Freiberg, who chaired the Preventative Health Division that was, the bills went through to come to health, and all of the members in both parties on all of our committees and divisions. You are appreciated so very, very much. So now I'm going to talk about the bill. Even the thank yous are long on this bill, but just to try to briefly explain a little bit about what this bill does. This is a bill that puts Minnesota on a path to success by making healthcare more affordable and accessible for Minnesotans. We know that many providers, healthcare providers in Minnesota, do a fantastic job. They work so hard to keep Minnesotans healthy and help all of us when we're in need. We ask them to perform miracles, and often they do. But too many Minnesotans still can't access healthcare, even if they're insured, because of the cost. or they can't get an appointment when or where they need it. It almost goes without saying that the pandemic has revealed how tied together we all are. We matter to each other, not only because our religious traditions tell us so. We have really seen, literally seen, how one person's illness can impact everyone. One person's illness can even start a worldwide pandemic. So it is very important that we pull together and make sure that everyone gets the care they need when they need it. This bill puts Minnesota on a path to success by improving access to insurance at lower cost, and it works to remove barriers to care, not just to insurance, but to health care. It works to find better and less expensive and more equitable ways of delivering health care to Minnesotans and keeping them healthy. It invests in public health and has resources in it to help us all be as healthy as possible. And it works to make sure that every child in Minnesota gets off to a healthy start. It takes real steps to control drug prices so Minnesotans who get a prescription can actually get the medicine they need to be healthy, or sometimes even just to stay alive. And doing that work, I want to say, is not easy at all because the drug lobbyists work hard to stop these bills. But the crisis for Minnesotans is just too large to let them stop these bills. Democrats in this legislature are standing up to the lobbyists and forging ahead. This bill works to sustain the healthcare workforce we have now and build it for the future, because Minnesota's needs are growing and we must make sure that we are prepared for that. And that means making sure people from diverse backgrounds and communities have the opportunity to achieve their dream of becoming a healthcare provider, because we need them now more than ever. So there is so much more I could say about this bill. I'm sure we're going to have a lot of discussion. You're going to hear now from Chair Schultz describing a little bit more about her part of the bill and some of the other chairs. And thank you so much for the privilege of allowing me to chair the Health Committee and for all of your hard work this session. Thank you, Madam Speaker.
The member from St. Louis, Representative Schultz.
Thank you, Madam Speaker. I also want to add my thanks. Thank you to Yingya Vang, my committee administrator. Thank you to my CLA, my legislative assistant, Lindsay Hansen, who really stepped up to do multiple committees, as well as being a legislative assistant to 2 members. Thanks to Patrick McQuillan, who helps on Team HHS. He's the hardest working CA I've ever worked with. And Chris McCall, who also helps towards the end of session. I also want to call out the DHS and MDH agency staff, who really do help us facilitate passing good policies in our state for the people of Minnesota. And this includes Christy Grom, who I work closely with in my committee. I want to thank the chairs of the divisions, Chair Peter Fisher, who worked in behavioral health, and Chair Aisha Gomez, who worked in preventing homelessness, and they'll both be speaking later today. I also want to thank Chair Liebling, who I've worked closely with for the last 8 years, and I really appreciate her extensive knowledge of healthcare, her devotion to the people of Minnesota, and I will miss working closely with her as I do not seek re-election. Members, this is another Health and Human Services bill that makes historic investments in human services. Services that help people every day. Older adults who prefer to stay in their homes rather than enter a nursing facility. People with disabilities who wish to live independently with services that they rely on. And caring professionals who devote their lives providing services to those who rely on them to survive. We are investing resources into addressing the healthcare workforce shortage, increasing wages for personal care assistants, funding for training to increase our healthcare workforce pipeline. The healthcare workforce shortage was a priority for our committee this session, and also creating a workforce incentive fund to fund employee retention in our caring professions. Members, when we invest in people, we all do better. When we invest in one another, when we care for our community, our family, our friends, our neighbors, we all do better. This HHS bill makes these investments. It invests in the people across our state. So I hope that you will support it.
The member from Ramsey, Representative Fisher.
Thank you, Madam Speaker. I rise to support this bill, and first of all, I'd like to thank the people who really helped out. First of all, our committee administrator, Lindsay Hansen, our legislative assistant, Spencer Kroos, Dave Sullivan and Harry Kennedy, who are DFL and Republican researchers, and Sarah Sutterman, who is from House Research. I also like to thank the members for their engagement, especially Vice Chair Frederick and Lead Frankie. The committee did a lot of great work this year. The Behavioral Health Division did a lot of great work this year with every bill passing out with unanimous support. We heard often that there was a lot of crisis in the substance use disorder world and in the mental health world, that we're having more and more people needing services, and there's a greater need as people are dealing with challenges in their lives. We need to make more services available. We heard in committee from many people. One of them was Hope Grothwald, who came before us and explained to us how critical programs helped her. She told her story about how she was dealing with mental health disorders, and that the services that were provided to her very early on helped save her life, helped keep her from becoming homeless, and allowed her to continue her education and to prepare her for her future career. One of the things this bill does is provide dollars and funding to increase the services out there to make sure that people like Hope will continue to be successful and productive in our society. Another area that we heard a lot about was the workforce shortage. Our Minnesota communities are facing an urgent need for dedicated, compassionate individuals to provide care for people with substance use disorder and mental health issues. This bill supports these SUD and mental health workers by providing funding for wages, grants, scholarships, and technical assistance to expand our compassionate workforce. And with that, I will move on. You can move on to the next speaker.
The member from Hennepin, Representative Gomez.
Thank you, Madam Speaker. I too have to start with thank yous, of course, to Vice Chair Heather Keeler and GOP lead New Brindley and all of the members on both sides of the aisle for all of the thoughtfulness and care that they brought to this work. To our really sharp and talented nonpartisan and partisan staff, to House researcher Justin Cope, our fiscal analyst Joe Harney, DFL researcher Molly Peterson, GOP researcher Chelsea Axelson, our committee administrator, Sean Herring, and to our CLA, Robin Schmidt. Thank you so much. You have our gratitude. So every year, 50,000 Minnesotans experience homelessness. And on any given evening, there are 20,000 people in our state, in every region of our state, who don't have a place to lay their head. The investments in preventing homelessness in the human services portion of the bill are the centerpiece of our response to this pressing issue. But you'll see all across our supplemental budget bill, and we've already heard some of these things, in the housing portion, in veterans, in capital investment, in health. We are acknowledging the severity and depth of this crisis and being real about what it will take to meet this moment in a way that serves those in our communities who need it the most. The comprehensive approach across our budget says something very clear and simple to our communities. In a state with a $9.5 billion surplus, no one should be sleeping outside. And we will not stand by as people in our communities, our people, fall through the cracks. A society with a growing homeless population, where, as in Minnesota, the fastest growing demographic entering homelessness are seniors, are elders, is a society whose systems are not meeting the needs of its people. Systems that have been cobbled together in response to crisis, not because they were necessarily the best approach, and systems that have never been adequately funded. The deep racial disparities that plague our state are borne out here too. When you control for income, Black Minnesotans are 13 times more likely and Native Minnesotans 22 times more likely to experience homelessness. The investments in this bill constitute a transformative step. The bill responds directly to the needs that we've heard over the last few months and in the last 2 years in our committee. And I can only assume for years and decades before this committee came together, from service providers, from advocates, local government partners, and most critically from unhoused people and formerly unhoused people themselves. We have amazing partners in this work, folks across the state in each of our communities who are hustling to make positive changes happen on a shoestring for some of the most vulnerable among us. With this bill, we're telling those providers who've moved mountains during COVID to keep their staff and their clients safe that they're not alone, that we have their back, that we've heard their needs and recognized that this moment of surplus, moment of plenty, is the time to support their work by building more than 1,500 shelter spaces in every region of our state and committing long-term to supporting the operations, case management, and support services that they need to do their work. We're telling our lowest income seniors and veterans that we don't think they should have their Social Security or VA benefits taken when they have to access shelter. We're telling our largest counties who have stepped up in these times that we're there for them, that we're not going to let the people they're serving fall off a cliff. And we're telling young people in our communities, those 16 to 24 who are not living with loving adults, that they're not alone. We're telling these young people, many of whom have been failed by the grown-ups in their lives, more than half of whom we heard in our committee have been in foster care, that we know they need specialized services to meet their needs so that they can become self-actualized members of our communities. We're telling them that they're worth investing in, and that we know it's not only the right thing to do from the perspective of fiscal responsibility, that we either pay now or we pay later in 100 ways, but that it's the right thing to do as human beings in community with one another. And we're telling our kids who have experienced homelessness and have been sexually exploited and trafficked, kids as young as 10. They had to change the parameters of this program to serve children who are 10 years old who have been sexually exploited and experienced homelessness. We're telling them that we're going to protect them and that they matter and that nothing they've done and nothing that has been done to them has ever touched or diminished the truth about their goodness and their intrinsic value. We're telling them that we're going to support them on their journeys of recovery and that we will fight for them. And I'm thankful that my committee passed that particular measure unanimously. Thank you to the committee members. So we have a chance today to change that story of underinvestment in those that need it the most. We have a chance to prevent more people from falling through the cracks. And I hope that we can earn your support. Thank you, Madam Speaker.
Thank you, Representative Gomez. The member from Hennepin, Representative Freiberg.
Thank you, Madam Speaker. I'm really proud of what we've accomplished putting this bill together, and I'm proud that it contains many provisions we heard in the Preventive Health Policy Division. So like other members, I couldn't do it without the great staff, both partisan and nonpartisan, that helps make us all look good. I'm terrified of listing all of their names, however, for fear that I will forget somebody. So I will move on to the bill. This bill will offer solutions for a healthier Minnesota. The bill will help us develop guidance for diagnosis, treatment, and care coordination for long COVID. It will help us rebuild state and local public health infrastructure and provide support for tribal care providers. Finally, it will help eliminate lead in schools, child care centers, and homes. We heard testimony about the dangers of lead in the Preventive Health Policy Division and heard consistently that there is no safe level of exposure to lead. The bill includes Representative Acom's proposal to fund testing and remediation for lead in drinking water, which we heard in the division. It also includes other provisions to address the hazards of lead, including Representative Jordan's proposal to modify the definition of elevated blood level, her proposal to create a grant program for lead service line replacement, Representative Howard's proposal for lead reporting in schools, and the governor's request that will enable cities to conduct an inventory of lead service lines. All of these provisions will have a clear public health benefit because of how harmful lead exposure can be, particularly for children. The HHS bill includes other proposals that we heard in the Preventive Health Policy Division, including Representative Bolden's proposal to fund a distribution program for COVID-19 tests and masks, Representative Hassan's proposal to increase public awareness of the risks of skin lightening creams, Representative Morrison's proposal to require coverage of commercial tobacco cessation treatment, and Representative Sandel's proposal to establish school-based health centers. These proposals all speak to the bill's focus on public health and prevention, which is particularly important as we are still experiencing the effects of COVID-19. I will be glad to support this bill and encourage other members to do the same.
The member from Ramsey, Representative Pinto.
Thank you, Madam Speaker. Members, Health and Human Services is a really critical and also complicated area. There are 6 committees that oversee it in our House, and so I'm the 6th and final committee chair to present the bill to you. I, too, want to thank my committee administrator, Sydney Spreck, and committee legislative assistant, Hans Dosland, and our amazing partisan staff, Mars Beltrandi-Rudquist for the majority, Jody Withers for the minority, who have to work in both this area and in the education area. And a shout out to my lead, Representative Franson, for her partnership in this work. Members, our committee has focused especially on childcare and early learning, as you're aware. This is a sector that was in deep crisis well before the pandemic. The families in our districts have had this be unaffordable and inaccessible for them, paying as much as 40% of their income for the care that they need to go out to get the money they need to pay the rent and pay the food and to pay for the child care that they're getting to do all those things. Members, this is a sector that has paid its workers poverty wages. About a third of them are on public assistance themselves. A quarter experience food insecurity. Members, the bill before you addresses these needs. We increase rates for the Child Care Assistance Program to meet the federal standard for equal access for families, up to the 75th percentile. And we expand the program's accessibility for foster parents, for guardians, and others who especially need that support. And then, members, we also continue the monthly stabilization grants that have been going on since the beginning of the pandemic. You may not be aware we were the very first state to start providing support for the sector. That is why you have not heard about a collapse of childcare in your communities, is because those payments have been going out. We will continue those payments to make sure that we have public support for this public need. Members, there is nothing more important than getting our kids off to a great start. I am thrilled to have these provisions from our committee be linked with the provisions throughout this incredible bill to support kids in getting off that great start. As Representative Freiberg referenced, getting lead out of our communities so that kids' brains are not being impacted by that. It's incredibly toxic, even a small amount. There's proposals for voluntary home visiting to make sure that families have a check-in if they choose when the baby's born, to make sure that they have the support that they need. There is so much more. Members, I'm proud to have had the work of our committee be joined to those of the other committees you've just heard about, and are really eager to have a discussion today and earn your support at the end of this debate. Madam Speaker, thank you, and thanks to all.